Hello friends, welcome to part 4 of the Osce sessions on the practice of Osce. In this component, we are going to look into the interactive Osces and how to prepare for them. And this is a replacement of short cases, and very commonly now we are putting up the interactive Osces in the even professional exams. So practice of interactive Osce is a very important thing for you to learn, because this is again done into a limited time frame and the tasks are a little complicated, so you should be aware. So I'm going to give you some examples how to prepare for interactive Osces. So there is an interactive station in the this particular part. You have to do some procedures in presence of examiners. So there are different procedures, like IV cannulation is one, maybe in the mannequin, or catheterization again in the mannequin, or ABG. There would be a procedure which you have to describe the procedure. Then lumbar puncture again in mannequins, bone marrow aspiration again in mannequins, then endotracheal intubation again in mannequin, and then inserting the CVP line. So these are some of the procedures which are kept in mannequins, and then there may be some other counseling stations or history stations. So that's how we prepare the stations. Now I am going to give you how to, what are the ABG station. For example, there is a stem that mention the steps of how do you do ABG. So in the first part of the thing is, you should know about the equipments required for the measuring of the ABG. So you should look into that. Nowadays there is a pre-heparinized syringe which is already coming into the kit, and there is a syringe of 2 ml with a needle which may be 23 gauge needle, and this is the broadly the method. But before you go into this method of doing ABG, you have to do the Allen's test first. So if you look at the Allen's test, you have to perform the Allen's test in the patients. You are doing a radial artery ABG. So you locate the radial artery with your index and middle fingers and perform the Allen's test. So you will compress both radial and ulnar on the arm, and then keep it compressed till there is a blanching, and after some time you will release the ulnar artery and the circulation will be restored to suggest that there is a proper collateral circulation. If the proper collateral circulation is not there, then you should not do the ABG on the radial artery. There is a complication like occlusion, so that may put the hand in the jeopardy. So if you look at the test, so wash your hands, scrub with your properly, because it has to be into disinfected with all aseptic precautions. And before that, you will do a consent, of course, with the informed consent, and then gather the instruments and clean the part. After cleaning the part with the alcohol, gel, or gauze, and then localize the by your 2 fingers. You will put your 2 fingers, and then in between, mostly I used to do with in between the 2 fingers, the needle is put. Maybe a pencil technique, you can use a pencil technique, like if you look at the pen, you can do a pencil technique directly, or you can do a 90 degrees or 45 degrees. And usually the needle, and once you have taken out the 2 cc of blood, another precaution is that don't pull this piston, because it's a arterial pressure, it is quite high, so it is going to fill automatically. And then at the same time, you are going to plug the needle with the stopper and put in the ice pack and send for the test in 15 minutes of time. So this is one of the things which you should know, that when this is one of the stations which we put, and it's a good station to score good marks. Then facial nerve examination. This is another station like trigeminal nerve. Similarly, facial nerve is another one which we commonly put into the examination. So there are 4 components in which, again, here I would like to tell you that please give a commentary when you are putting all the component. Like if you are testing the frontalis muscle, then you ask the patient to put the wrinkles on the forehead, squeezing of the eyes, then you are testing the orbicularis oris oculi, and then ballooning is orbicularis oculi, and then grinning. So all these component. Apart from that, you have to test the sensory sensation in the anterior 2/3 of the tongue. So you, for that purpose, you have to have the liquid solution, sweet and salted solution, and a dropper, and then ask the patient to protrude the tongue and close eyes, and then put a drop and ask the patient to, without putting the tongue inside, they have to point out that which is the sweet is number 1 or salt is number 2, like that. You have to give some explanation to the patient before you perform the sensory of the 2/3 of the tongue. Now, if you look at the this is a Bell's phenomena. So there is a half closure of the eyes on the left side. So there is and the angle of the mouth is deviated to the non-affected side. So diagnosis is Bell's phenomena. Then we ask you the causes, like any tumor in the CP angle, or mastocytitis, chronic suppurative otitis media, or herpes. These are some of the causes which you should remember in this particular OSCE. This is another station which is a counseling station. Like when we tell you to take a history, similarly we may ask you to do a counseling. So here the patient is having treated with diabetes. There may be an SP who is being told that he is suffering from diabetes, that diabetes is uncontrolled, and you have to counsel the patient to take insulin, and the SP is trained that he has a needle phobia, so he will resist to your suggestion of taking insulin. So you have to explain to him that why it is important to take the insulin and prevent complications like cardiac complications, or renal complications, or amputation of the foot, or the ophthalmic complications. All these things you need to put into the patient's evaluation. So this station is again carrying a objectively structured thing. So if you do not also tell them about the hypoglycemia and diabetic ketoacidosis. Similarly, there may be another station where there is a patient with early fatigue and shortness of breath, and there is a history station. So this is one is the counseling station, another one is the history station. In this one, you will have to take the relevant history, because the patient is presenting to you with a history of shortness of breath. So the diagnosis may be cardiac failure, or maybe pneumothorax. So accordingly, your each questions have to be relevant to your differential diagnosis. So you will make some differential diagnosis, and then accordingly you plan your questions. But for example, you make 4 differential diagnoses, so you have 6 questions there, and accordingly you will frame questions, and also for social history and the family history. So this is how you have to prepare yourself relevant questions. So please practice these different types of OSCEs. And there's another one in which peak flow meter is being used. So a patient is coming to you with acute attack of asthma and treat with the nebulization. So please explain about the peak flow meter and demonstrate how will you do before and after the treatment. So you should know about the instrument and the red mark and the yellow mark and the green mark. So green mark is a better one. Red mark, immediately you should rush to the hospital. Yellow mark, you should titrate a dose, maybe 1 or 2 puffs of MDIs. So I explain how frequently to use, how to clean the instruments and keep the instrument properly clean, then what are the precautions, and note the readings in a proper chart. So all the idea of all these interactive OSCE is that how um, professionally you have looked into the procedures and how professionally you are able to demonstrate the technique of examination, and that's what is very much required when you go to the wards as a house officer. You should be able to do it. So when we conclude about the OSCE practice, we see that it's a valuable and well-developed assessment approach in all the health professionals. It tells us about the psychology to develop and share the OSCE scenarios for essential components and for functional competencies. Ranal Harden, one of the pioneers in developing these OSCE, rightly says that when OSCE is used correctly, can be highly successful, and it is an instrument to assess the competency in the medicine. At the same time, if you look at the statement from Albert Einstein, he says that education is not learning of the facts, only not recall, but training the mind to think about it. So it is all that how your mind is trained, and I'm sure this video is going to help you to prepare for both digital OSCEs and the interactive OSCEs, and give you a process of learning and appearing for the exams. Cheers. Thank you so much.